One of the most common questions that I get when starting a patient on a GLP-1 medication is how and when to increase their dosage. My name is Philip Marks and I'm the nurse practitioner at Regenics, and we're going to be discussing just that today. One of the first things I look at when deciding about a dosage change is side effects. The most common side effects that I see with these medications are nausea, heartburn, and constipation, among others. If side effects are mild and tolerable, and someone is not getting enough appetite suppression, then oftentimes we will increase the dose. If, however, the side effects are moderate or extreme, then a dosing increase is not warranted, and in some cases, we may want to decrease the dose. At Regenics, we send a monthly questionnaire that will check in on your progress, any side effects, and your current dosage. When we're asking about side effects, you'll be able to select from mild, moderate, or extreme symptoms. This helps guide us on whether or not to make a dosing increase or decrease. Medical providers like myself will use the answers to these questionnaires to make decisions about your personal dosing. A patient does not have the authority to make dosing changes on their own. A medical provider will always prescribe you your weekly dosage. Another thing that we assess in regards to your dosage is your rate of weight loss. Typically, I try to have patients lose about 1 to 2 pounds per week or about 8 to 10 pounds per month. If a patient is hitting these goals, then the dosage is correct. If, however, someone is not losing weight, then a dosing increase may be warranted. And in some cases, patients may be losing weight too rapidly. This would include muscle loss and hair loss, in which case we would want to decrease your dosage. Another metric that we incorporate in deciding on your dosage and treatment plan is your body mass index, or BMI. This is a measurement based on your height and weight. Anyone over a BMI of 25 can continue with their weight loss treatment plan. Once your BMI goes below 25, we want to have a plan in place to decide when to stop your treatment. Typically, I'll allow patients to go as low as a BMI of 23, or depending on their progress, a little bit lower. Once your BMI reaches 21 or less, then we would want to stop the medication or at least go back to a maintenance dosing where you're maintaining weight but not continuing with weight loss. In regards to your dosing, we also like to assess your degree of appetite suppression. Typically, the goal with your dosing is to have your appetite suppression last about 5 to 7 days. If this is not being met, then a dosing increase may be warranted. If you are experiencing persistent hunger and the medication isn't dosed sufficiently, then let your medical provider know and we can increase the dose accordingly. The goal with the dosing is to have your appetite suppression last about 5 to 7 days, where you're specifically feeling less hunger, less cravings, and feeling fuller faster. We of course also want to take into consideration your personal preference on your dosing. In your questionnaire, you'll be able to answer whether you want a dosing reassessment or to simply stay at the same dose. If you want to stay at the same dose, then your medical provider will honor that request. If you want a dosing reassessment, then we will take into consideration your progress, side effects, and appetite suppression, and make a dosing adjustment accordingly. At Regenics, we want to make sure that you're getting the proper dosage for your medication. Working hand in hand with your medical provider will get you the best results. Be sure to fill out your monthly questionnaire so that we can gather information on your progress, side effects, and dosing. This way we can get you the best results for weight loss and preventing side effects. If you're new to GLP-1 medications, please check out this next video on proper injection techniques.